This segment is sponsored by Southeastern Orthopedic Institute. The claims and opinions made in this segment are not necessarily those of Live 5 WCSC.
Today I'm joined by Dr. Mark Harrow from the Southeastern Orthopedic Institute. Dr. Harrow, thank you for joining us.
Thank you.
First off, tell our audience what arthritis is.
Well, there's different types of arthritis, but the most commonly thought of arthritis is osteoarthritis, which is essentially losing the cartilage in your knee or shoulder or other joint, which essentially, the analogy I like to use, it's the tread on your tire that's kind of starting to wear away.
How do most people develop arthritis or cartilage injury?
Yeah, I mean, there's different ways. Usually we think about it as like an overuse or something that develops over time, or it can happen after traumatic injury or several years after traumatic injury.
If someone finds out that they have arthritis or cartilage injury, does that necessarily mean that they need a replacement?
Not necessarily. We have all sorts of different treatment options, and the way I usually break it down is there's the non-operative treatment of arthritis, and then there's the operative treatment of arthritis. And the non-operative treatment is various injections, sometimes physical therapy, certain braces that can help kind of modify your symptoms from arthritis. But as we get to the surgical side, some of that depends on age, activity level, and it gets a little bit more complicated. We can do, in younger people, cartilage transplant type procedures or trying to regrow your cartilage in certain areas. But sometimes we do end up doing knee replacements or shoulder replacements to deal with some of these issues.
What are some of the procedures that are easier on the patients?
Yeah, I mean, so obviously non-surgical treatment is the easiest, and usually that's the place to start. But again, in younger active people, sometimes, debriding the lesion or the cartilage defect that we have and potentially trying to replace that can prolong the duration that they are able to keep their own cartilage.
Dr. Harrow, thank you very much for joining us.
All right, thank you for being here.
For more information, please visit southeasternorthopedic.com.